Overindulging can cause a number of gastrointestinal ailments, including GERD. November 24th through the 30th is GERD Awareness Week. The specialists at Advanced Gastroenterology and Surgery Associates explain what GERD is, how to manage it, and ways to avoid flare-ups not only during the holidays but year-round.
GERD just means gastroesophageal reflux disease, so it's basically the same thing. It actually is a motility disorder. People normally think that it's just acid, but it's just reflux of gastric contents into the esophagus that causes the symptoms. So it really is a motility problem. It's a problem of refluxing. We all have transient relaxation of the muscle at the end of the esophagus, so we all get a little bit of reflux. If you eat a pizza or fried foods, fatty foods, you get a little bit of reflux. But some people get it much more often. People with hiatal hernias, where part of the stomach is slid up into the chest, tend to be more prone to get acid reflux, and they tend to have more significant problems. But it really is a motility disorder. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures, elevating the head of the bed, avoiding lying down postprandially, avoiding some types of food, some medications are vitally important, because we really have no great motility drugs to treat acid reflux.
A couple of food right off the bat, which I ask my patients to avoid when they come in. Tomato products, and not the fresh tomatoes, is actually the tomato sources. So in your lasagna, spaghetti, and pizza. Why? Because when you cook down the fresh tomato with the heat, the chemical bond is broken up, and so therefore it causes the tomato sources to be very acidic. Now that goes along with citrus, so your oranges, grapefruits. But believe it or not, peppermint can also cause that. So the myth is that when a patient has acid reflux, they may get a bad breath, a condition called halitosis. And so therefore they chew on peppermint candy too, but that essentially makes the acid much worse. And then also chocolate has been blamed on, as well as caffeine.
The anti-reflux measures are very important. So elevating the head of the bed is extremely important. We normally recommend 6 to 8 inches with blocks or a wedge. And of course as well, not lying down after eating, because you want the stomach to empty at least 3 to 4 hours after a meal. You shouldn't lay down, because then you sort of increase the chances of reflux of gastric contents.
The specialists offer some simple tips to help you avoid GERD, reflux, and heartburn while enjoying a rich holiday menu. Don't overeat. Chances are your eyes are bigger than your stomach. Limit rich foods and alcohol, especially if they're not part of your usual diet. Avoid laying down shortly after eating. Instead, consider a leisurely walk. Chew gum after a large meal. It helps produce saliva, which helps counter the effects of the stomach acids. AGSA offers diagnosis and treatment for numerous gastrointestinal conditions. For more information about their services and Lake County office locations, click the GERD Awareness Story Lake icon at yourhometownhealth.com.